My name is Narda Muhammad. For my report, I will focus on the prevalence and causes of schizophrenia.
In understanding schizophrenia, researchers look at different layers to explain what causes disorder. They study four main areas: genetics, how drugs affect brain chemistry, brain abnormalities, and environment risk factors. This shows that schizophrenia is not caused by just one factor. It's a combination of biological and psychosocial influences. Kaya hindi siya simpleng i-diagnose or explain because it involves both the mind and the environment around the person. Schizophrenia affects roughly 1% of people around the world. Usually, symptoms start showing up in late adolescence or earlier adulthood. Both men and women can develop schizophrenia, pero may difference sa timing ng onset. Men usually experience it earlier, sa late teens to early 20s, habang women sa late 20s to earlier 30s. When it comes to the causes of schizophrenia, researchers look at several factors. Una, genetics. Kung may family history, may higher risk. Then, brain chemistry is important. Imbalances in neurotransmitters can affect behavior. Brain structure abnormalities can also play a role. Lastly, environmental factors like stress, trauma, or prenatal exposure may trigger the symptoms. Here we can see that schizophrenia is not just for a short-term condition. It is chronic, which means it lasts for a long time and affects how a person lives day to day. Most patients have trouble building or maintaining relationships. That's why many of them don't marry or have kids. Now, in terms of prevalence, study shows that schizophrenia affects about 0.2% to 1.5% of the population. That's roughly 1%. If we think about it, sa isang school with 1,000 students, about 10 of them might experience schizophrenia in their lifetime. So kahit rare siya compared to other disorders, it's still significant. Another point is the difference between men and women. Men usually develop schizophrenia earlier and the chances decrease as they grow older, although it can still appear even after age 75. For women, mas mababa ang risk before age 36, but after that age, mas mataas ng possibility compared to men. Research also shows that women generally have more favorable outcomes than men. Schizophrenia usually starts showing in late adolescence or early adulthood, pero minsan may signs na siya sa childhood, tulad ng delay sa speech, unusual na motor behavior o difficulties sa social interaction. Importanteng malaman na genetics ang malaking factor. Kung may family history, mas mataas ang risk. Pero hindi lang yun, pati environmental factors tulad ng stress, habang nasisinapupunan or early trauma, pwede rin makaapekto. Sa brain, may changes sa structure at function na nagre-resulta sa cognitive at emotional difficulties, kaya mahalaga ang early recognition at intervention para ma-manage ng maayos. Schizophrenia is universal, affecting people across cultures. But how it diagnosed and treated can really differ. Some argue it's just a level for unusual behavior, pero we know it's real because of the pain it causes patients and their families. Stress from social, political, and economic problems, limited mental health services, and cultural bias can make outcome worse. Ethnic minorities sometimes face misdiagnosis and stigma or discrimination adds more challenges. So culture shapes not just the diagnosis but the experience of schizophrenia. Genetics play a huge role in schizophrenia. Pero tandahan, having the genes doesn't mean na automatic na magkakaroon ka. What it does is increase vulnerability. Family and twin study shows that the closer you are genetically, the higher the risk. For example, identical twins have much stronger chance than fraternal twins. Adoption study also support this kasi kahit lumaki sa ibang environment, the risk is still there if may genetic vulnerability. So overall, it's not just one gene. It's the combination of many genes that makes someone more susceptible to schizophrenia. Treatment for schizophrenia really depends on culture. For example, in South Africa, many Xhosa people still go to traditional healers. Minsan gumagamit pa sila ng rituals like inducing vomiting or even animal sacrifice. Meanwhile, Latinos often rely more on their families kaysa sa institutional settings. In contrast, sa Britain, mas ginagamit nila yung medical, psychological, and community approaches. Sa China naman, common pa rin yung alternative medicine at ancestor worship. Sadly, in some countries like Bali or Africa, there's a strong supernatural beliefs and lack of resources, limited na paggamit ng anti-psychotic medication. Minsan pa nga people with schizophrenia are kept in chains or confined, tulad ng nakikita natin sa picture. Pero in Western countries, ongoing na yung movement from big institution papunta sa community care kasi mas humane and effective yun for recovery. So when we talk about prevention, the main strategy is early identification. Thirdly, child of parents with schizophrenia are considered high risk, around 17% chance to develop the disorder. Kaya nga researchers like Mednick and Kolsinger in Denmark studied this child back in the 1960s. When they found is that aside from genetics, environmental factors also matter, like pregnancy, complication, or unstable family environments. Imagine if that parenting is poor, it adds more stress to a baby already vulnerable. Today, one prevention method getting more attention is early intervention during the prodromal stage. Ito yung time when a person start noticing mild symptoms like small hallucination or delusion, but still aware of them. Intervening earlier could actually stop the progression of schizophrenia or even prevent relapses. That's why awareness and early action are very important. And that's all for my part. Thank you.